Good morning, my dear student. Next, we will discuss with the chapter from Dentifrices. Let's see the objective questions from Dentifrices. So, Dentifrices, it's a typing mistake, text mistakes, not Dentifrices. So, it is Dentifrices. Tifrices, Dentifrices are the compounds that are used for cleaning teeth and gums. So the cleaning action of dentifrices depends on their abrasive. So depends upon the abrasive added in that paste or powder. So there are different types of formulations comes under dentifrices. So this abrasive help the clean the teeth, clean the teeth and as well as gums. So next question, to prevent dental caries, toothpaste containing sodium fluoride should be used. So this is the most important and might be expected questions from exams. So what is the role of sodium fluoride? Here the sodium fluoride helps to prevent the dental caries. So dental caries means everyone. So dental caries is nothing but it's a medical term for tooth decay or cavities. If you are suffering decay or cavities, so how do you treat them? By giving the patients or giving them with the toothpaste containing sodium fluoride. Next, fourth question, soluble salts of phosphates are, there are two types of phosphate, mono and dihydrogen. What is the two salts? Sodium monohydrogen phosphate and sodium dihydrogen phosphate. Don't get panic. So there are two types of phosphates, mono and dihydrogen. Before you should add sodium monohydrogen and sodium dihydrogen phosphate. There are two types of soluble salts of phosphate in dentifrices. Okay, so fifth question, you know the answer. It's a medical term. Dash is a medical term for tooth decay or cavities, is nothing but dental caries. Sixth one, concentrate of fluoride in drinking water. Concentration of fluoride in drinking water is nothing but 1.5. We are to be measured in terms of ppm, parts per million. So how much is required in drinking water means 1.5 to 3 ppm. 1.5 to 3 ppm. Then seventh question, stannous fluoride is prepared by heating. So how do you prepare? So in that question you have answer stannous fluoride. We need stannous and fluoride. So stannous in the form of stannous oxide and fluoride in the form of hydrofluoric acid. So stannous fluoride can be prepared with the help of stannous oxide and hydrofluoric acid in the absence of oxygen. So we can prepare the stannous fluoride. Sodium fluoride and stannous fluoride, it plays a major role to prevent the dental caries or tooth decay. So stannous fluoride and sodium fluoride. Next, what is the chemical formula for sodium fluoride? NaF is the, and stannous fluoride, Sn for stannous. Fluoride means F2 here. So Sn F2. Sodium fluoride NaF and stannous fluoride SnF2. Then ninth question, we'll move on ninth questions. Dash reduce the sensitivity of teeth to heat and cold. Desensitizer. What is that? Desensitize. Sensitize and desensitize. So which one reduce the sensitivity of while we are drinking coffee, hot coffee or cold, you feel some sensation or some pain along with the pain. So because of that enamel to be rubbed or the enamel to be eroded, that is the main reason So what is that proper treatment? By giving to them desensitizer to reduce the sensitivity of teeth to heat and cold. Next, precipitated chalk is nothing but calcium carbonate. So next we'll let us see the objective type. Fluoride inhibits caries formation via, what is that? Fluoride inhibits, there are two main, which will inhibit the inhibition and downward acid solubility of enamel. So once that it help to formation of enamel. So this enamel, it's nothing but covering layer of, first covering layer of your teeth, which will eroded by something. Suppose if you are taking any hardy food material, so it is to be eroded. So that is the main reason you are getting sensation while you are taking hot tea or cold. So here the sodium fluoride, which will brings you to form the, that means which will downward or which will prevent the acid solubility of enamel, and also it will prevent the inhibition. That's why sodium fluoride is most important to prevent the dental caries or tooth cavities or dental cavities. Okay, next one, hydroxyapatite is a mixture of calcium salt of, hydroxyapatite is a mixture of calcium salt of carbonate, hydroxyl and phosphate. All of this is not much important, so you leave about it. So far we have discussed about dentifrices. What are dentifrices? What is the role of sodium chloride? What are the to reduce the sensitization, means desensitizer is to be used. So this will help you to score good marks from the exam. Thank you.